Your back is stiff and you want to know exactly what's going on. That's what the subject of this video is, so stay tuned. Hey, this is Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Chiropractic Posture Movement Clinic. Back stiffness is unfortunately a lot more common than people realize, and it has nothing to do with your age. You can be young in your 20s and have stiff back, and you can be old and have stiff back. Not every stiff back is the same. So when you first wake up in the morning and you're stiff, and with movement it goes away, more than likely it's arthritic cause. Now, arthritis, despite what you may think, has nothing to do with age. It has everything to do with dysfunctional presence, dysfunctional movement. So of course, in the old days, people were a lot healthier. So they would end up going to a doctor's office, have an x-ray done when they were older, and we were saying, oh, there's a deterioration. You're old deterioration, yep, must be deterioration happens in old people. Well, that is not the case exactly. Now, if you're stiff as the day goes by, that means you're overworking your muscles. You're going beyond what they're capable of giving to you, and they're becoming stiff, rigid, and not as easy to move. So what's the solution? The solution to the first version and the second version is the same. Functional mobility is the key. Functional mobility means not just getting from point A to B. Functional mobility means moving based on the design of movement, which you and I should not even think about. It becomes an issue when there's a deviation from it. Functional mobility, in my practice, we follow the principles of babies moving. Studied babies for a long time, understanding how they've moved, and then coming up with movements and principles that we implement in the practice and we go over with the patients. It's called DNS, Dynamic Neuromuscular Stabilization. That's what we do with our patients. That's what we do for arthritic patients. That's what we do with people who are doing too much. And they're getting stiff as a result of not paying attention to what the muscles are capable of doing, what the joints are capable of doing. Now, for the second group, you gotta understand it's okay to stop doing certain things, and it's okay to modify it. It does not mean that you're a quitter. That just means you're recognizing your limitations today. Your limitations tomorrow are not going to be the same as today. They don't have to be, as long as you're working on removing them and improving them. Kaizen, one improvement one day at a time. That is what I wish for everyone to pay attention to, because we're actually destroying our bodies being off balance. If you have any questions, make sure you use one of the methods of contact in the description box to contact me. Follow us on social media. We're actively present on Instagram. And make sure you subscribe to the channel. I hope this helped. Take care.